I couldn't get answers, and my symptoms again were just getting so much worse.
Welcome to the Grit Unfiltered podcast. I'm your host, Dave Craig, a cancer survivor, caregiver, and the patient experience researcher. Working in healthcare and advocacy, we get to work alongside some remarkable heroes, but we don't often have the chance to hear the experiences that shaped them. Our purpose for creating this unfiltered podcast is to hear the personal experiences that shape who our guests are. Our guest today is someone who's played a significant part in helping me find my voice. And it's fitting that we're having this conversation now on the eighth anniversary since we first met at the Transforming Healthcare Conference in 2016. I'm honored to introduce MarlaJan Wexler, or as she's best known as a patient advocate and nurse, MJ. Hi, MJ.
Well, hello there.
How are you today?
I'm good. I'm excited to be here. Yes.
I'm excited to hear your unfiltered journey.
Yeah, I'm excited to share it. So let's get started.
All right. So please tell us about something significant about growing up that really shaped who you are.
So even though it's not specifically what we're going to be talking about today, I was born with a rare complex congenital heart defect called tetralogy of flow. I had 4 heart surgeries by the time I was 6, spent what felt like my entire childhood in and out of the hospital. And I think my experiences, really shaped me in the work I do, not only as a nurse, but as a patient advocate today.
What was it like at that young age, having that many hospital experiences?
Yeah, for me, it felt normal, which, sounds scary to say. Um, but again, it was just my normal. But I think, you know, as I started to get older and realize that I was not like any other kid I knew, that I started to understand how much I actually missed out on. So it was hard. There's a lot of trauma and anger that went along with it. But I'm here. So
And I know we're going to talk about finding your voice, and I'm sure for you, it started at a very young age.
in some ways, yes. In a lot of ways, no. When you're going through those experiences as a young kid, it's your parents or your caretakers that make all the decisions for you. So, in a lot of ways, it was just, okay, you're having heart surgery in, a couple weeks, or, you're going to the hospital, you have to get admitted, hold still for this blood stick or this giant tube going in you. So, again, it was extremely difficult because I just knew how much and how different I was literally from everyone else growing up around me.
You mentioned your parents, and I know one of the things that was a big part of your childhood was science with your dad. What was that like for you?
So my dad is probably the most brilliant human I've ever met in my life. He, by trade, was an aerospace engineer, but just loved to soak up as much knowledge as he possibly could. I would come home on college breaks, and he'd be reading like one of my physics textbooks for fun. Um, and it's just something from a young age that I shared with my dad. Obviously, I went into the medical field. Science is a huge part of my life. And it was just, one of the things that really connected me with my father.
Yeah. Do you have a moment that comes to mind of sitting next to your dad or talking about something like what really reminds you of that?
Um, I can't really think of anything like specific. He was so brilliant that if I asked him for help with my math homework, he just couldn't explain it in like normal people terms because he was just that brilliant. So he wasn't necessarily the one I went to for help with my math homework because he would sometimes get frustrated that we didn't always know, what seemed to him to be a simple answer. Not to say that he wasn't a great teacher. He was, but um, really, I remember things like watching, like the movie Apollo 13 with him, and then just, since he was an aerospace engineer, discussing like the nitty gritty science aspects that went into it, and him telling me, you know, that he had actually, my dad is much older, or was much older. Um, he had actually worked on that. He's worked on so many incredible uh, things in the space program through the span of my life. And even though he's gone now, we still hear about, like the Hubble telescope and different things that he had a huge part in.
Your dad was always starting at expert level.
He was. It was kind of annoying.
So then going into adulthood, I know that you faced something significant in your 20s. You were diagnosed with lupus.
I was. So knowing what I know about the disease now, I think I started showing signs in my early 20s. I was 22. I just started out with really vague symptoms like random rashes, waking up with joint pain. I was always tired. And I would go to my primary care physician, and they would just, you're in college full time, you're bartending full time, you're, probably drinking too much and not sleeping enough and not really taking care of yourself. So I was kind of blown off. And, they would send me for the normal labs like a CBC and, a chemistry panel, and they would always come back, within normal limits. So it was kind of just, sleep more, drink less, take better care of yourself. And, once, maybe some things calm down in your life, things, my symptoms will kind of go away, but they never did. And then I got married in early 2008, and 3 weeks after we got home from our honeymoon, I rolled over in my bed and gave what I thought was sexy eyes to my now ex-husband. And as I rolled over, saying, "Hey, baby," he looked at me in horror and was like, "What is wrong with your face?" And, not really what you want to hear from your brand new husband. First thing in the morning, and I jumped up, ran to the mirror, and realized that I looked like Shrek. I
Mm.
wasn't green, but I was completely swollen and unrecognizable. My eyes were practically swollen shut. I was covered in these random rashes, and that really began my diagnostic journey. I was in and out of ERs. I was scanned and scoped in every orifice. Multiple, what felt like endless vials of blood were taken, so many different tests. And I was told repeatedly that I was fine. There was nothing wrong with me. At that point, I was working full time as a nurse. I was back in school for my master's to be a nurse practitioner. I was flip flopping back and forth between day and night shift, and probably not eating well, and still in my mid 20s at that point. I'm still trying to have some semblance of a social life, and just kept getting told by every single doctor that I went to that there was nothing wrong with me. It's all in my head. Drink, drink less, sleep more, take better care of yourself. And eventually, quite a few specialists told me that I actually needed psychiatric help. And at that point, I felt like I had hit the proverbial wall. I was frustrated. I was angry. My symptoms were getting markedly worse. And, I am a healthcare professional. That's not to say that, a lay person doesn't know when something's wrong with their own body, but to be told by another care professional that I needed psychiatric help. And, in some of those moments, I might have thought they were right. But it was just incredibly disheartening, so frustrating. And, I couldn't get answers. And my symptoms, again, were just getting so much worse. And maybe like 7 months after that first ER visit, I had my then husband, drop me off at the emergency room. I woke up on a random Tuesday looking like Shrek again. I could barely walk. My joints were swollen. I was like, just take me to the ER, drop me off. I'm not leaving till I get answers. And, if you've been to an emergency room, it doesn't work that way. But a resident walked in, took one look at me, and was like, "Have you seen anyone from rheumatology?" No. And, I was like, "Well, can you just write the consult and let me see someone now?" And he kind of laughed. He's like, "I know you're a nurse, it doesn't work that way." So he put in the referral for rheumatology and sent me on my way. And a few days later, I finally got to see a rheumatologist. And in those few days between the ER and that initial appointment, I poured through my nursing textbooks, like trying to figure out what was wrong with me. And I landed on lupus, and I knew In my heart of hearts, that was it. And, I saw the rheumatologist, and it wasn't that simple. Like, yes, you have lupus when she looked at me. It was another 6 months of testing and diagnostics. And um, there's one specific test that points you in the right direction of a lupus diagnosis. It's called the anti-nuclear antibody. And 95 to 99% of lupus patients have that antibody. And me being me, of course, I was ANA negative, which didn't make the, diagnostic journey any easier. But luckily I had a physician who looked at the entire picture. And she did give me a diagnosis of ANA negative systemic lupus erythematosus. And that was in late August 2008 when I was 27. I just turned 27 like 2 weeks prior.
So what was the total time from the first time you went with symptoms saying something's wrong with me until you finally got your lupus diagnosis?
About 6.5 years, which is on average how long it takes a person to get diagnosed. It can take anywhere from 6 to 10 years. And that's mainly because lupus is called the great imitator. Lupus is an autoimmune disease, so something goes haywire with a person's immune system, and your body creates autoantibodies. Holy crap! And these autoantibodies just start attacking your own cells and organs. So it's. I always say lupus is like my body is playing Call of Duty against itself. It just starts an all-out war against your tissues and organs. And lupus can be mild to life-threatening. It can affect any organ system in the body. And it's a tough disease that doesn't get the publicity that it deserves.
So in that 6.5 years where all these things are happening to your body and you're meeting with different providers, how deflating or defeating does it feel to be told there's nothing wrong with you? I can't imagine what that feels like.
At first it's like reassuring. Okay, I've gotten the test they told me to get. I've gotten the blood work. Again, I'm a healthcare provider. I can look at labs and, read diagnostic reports and know what they're talking about. Okay, everything looks good. So at first you're like, okay, there's nothing wrong with me. And, obviously my journey may look completely different from someone else's. But as time went on and as my symptoms were getting progressively worse, you know, you do start to think, okay, is it all in my head? Am I crazy? And, no one knows your body like yourself.
Right.
No diagnostic test, no lab report, no physician can negate what you're seeing and feeling. Um, so it was probably the most frustrating 6.5 years of my life. And there's so many ups and downs. Again, it's like that relief, like, okay, there's nothing wrong. Okay, it's not this, to, oh my gosh, no one's listening to me. There is something wrong and no one will help me.
So we're recording this during Lupus Awareness Month, and
Yeah.
we're both wearing purple, which nobody can see, but we're both wearing purple. So, with everything you were just sharing, what are some of the misconceptions or misunderstandings about lupus in general?
So, as I said, lupus doesn't get a lot of the publicity it deserves. Most people know lupus from the show House. Literally, the 9 or 10 season long ongoing joke was it's never lupus. And, you know, a lot of times it's not lupus, but I'm here to tell you that sometimes it is lupus. And to have the disease that is, you know, exponentially changed every single aspect of my life really be the butt of the joke. It's tough. A lot of people think that lupus is just this mild disease that you take a pill and you feel fine and you go to work every day and it doesn't really affect you. But lupus has affected four of my major organ systems. Lupus is the reason that I'm infertile. Lupus caused a seizure that led to a bit of a cognitive decline in me. Lupus attacked my heart when I already have heart problems, and lupus attacked my lungs. So it is drastically changed everything in the trajectory of where I thought my life was going when I was diagnosed at 27.
One of the things, I hope it's okay to dig into this. One of the things that you've shared with me before, and I would love to talk about it, is the impact on your memory. And, for you being able to give talks and speeches is such a part of your identity. What is it like inside, trying to process and wrestle with those parts of lupus?
So a big part of lupus is what we in the community call lupus brain fog, lupus brain fog. I mean, we hear it often in the cancer community with like chemo brain. Um, but it really, not only am I very self-conscious about it, and anyone can be in the middle of a sentence and forget what they were saying or lose their train of thought or not be able to come up with a word, but it happens so often in my day-to-day that you know people have often dismissed me for being uneducated or not knowing what I'm talking about, and that is one of the most frustrating parts of the disease. Something that I can't control and have no idea when it's going to kick in. Some days I sound like Einstein. Some days I sound like a 3-year-old. Um, and it's difficult to kind of navigate, especially in my professional life when I'm trying to talk to patients and families. My friends are used to it by now, and that's just MJ. But it really has a profound effect on my professional life because I often wonder, you know, do well, I mean, advocates get it, but do the people in pharma even have really an idea of what I'm talking about? They think they understand, but they really have no idea. Wow, that was like straight out of the real world. You think you know, but you have no idea. Anyway, sorry. Um, But again, it's one of the hardest things to grapple with. It's had a profound effect on how I navigate my day to day and how I interact with people in my life. And I
I
almost
think
feel like I have to make a joke to, you know,
mm,
make up or explain for it. And it shouldn't have to be that way, but it's it's how I'm programmed.
with how much science and medicine and your admiration for your dad are just a part of your identity, I imagine that that must really impact you in profound ways.
It does, yeah. I already have, with my congenital heart defect, I had very low oxygen levels for the first 6 years of my life. So I can only imagine what that to me cognitively.
Mm.
Science should study me.
Mhm.
And, obviously kids with, and now adults with congenital heart disease, they have studied the neurocognitive effects of it. And there are, deficits obviously from that. But then to get another disease that causes another layer of it just adds on to the frustration.
I know at Grit, we always talk about modeling the way, being open about these things is how other people can see that it happens and to feel seen in these things. And so I know you being this open about something that hard, will help others that are not sure of what that means for them yet.
I hope so.
What other, before we move on, is there anything else? I mean, the things you've shared have really, I guess, surprised me in terms of how lupus affects your life. Are there any other misconceptions or just general misunderstandings?
So, the general population and even people that are newly diagnosed with lupus and don't know much about it, it's considered, a woman's disease. And it's true, 90% of those affected with lupus are women. That's a fact. But that's still 10% of the population affected that are men. And men are actually have more severe disease activity than women. Um, um, Seal, the singer Seal, I'm trying to think of famous men who have lupus. He has discoid lupus. You might notice, like in photos, that he has scarring all across his face, and that's just from the rashes that have led to severe scarring. Nick Cannon, comedian, singer, host of Masked Singer, I think. I'm not sure. Mariah Carey's ex-husband. He had pretty severe lupus nephritis, and he does a lot of work in the lupus community. But men do get the disease, and while it is, obviously greater population of women, we can't forget the men that are affected.
So thinking about you at the start of this journey, what advice or insight do you have for somebody that's either trying to get an accurate diagnosis or just starting this journey?
I always tell people first to listen to your body. A lot of the early signs of lupus, fatigue, rashes, joint pain, get brushed off. I always tell everyone, write your symptom down, even if you think it has nothing to do with lupus. 9 times out of 10, it does. And then you'll learn once you're diagnosed and you get this really weird random symptom that no one can really figure out what it is or what's causing it. They're usually just like, oh, it's probably lupus. So it's there's kind of a caveat to it, but listen to your body. Keep track of your symptoms, keep track of what makes it better, what makes it worse, and really just if you truly believe that something is wrong, don't stop until you get true answers. For most people, there's nothing wrong with you. You need psychiatric help. It's not an answer.
One of the things that I've admired ever since I met you as an advocate in 2016 was some of the posts that you put out that were just, so piercingly real that it challenged me to think about my own openness. What are the things that I wasn't comfortable talking about, and how do I start to find words to express those things? What's that been like for you over these years now? Becoming more confident, sharing the things that are difficult to talk about.
I'm not sure. I talk candidly about having post-traumatic stress disorder as a result of all the medical trauma that I went through as a kid. And that has certainly, shaped how I am affected by, this journey, in adulthood. Um, you and I have talked about this. Um, I dealt with a lot of that trauma through sex. And, some days, it doesn't bother me. Some days I'm not so proud of it, but it is what it is. It's how I dealt with unspeakable anger and trauma over what happened to my body. And for me, it was about control, something I know you and I have really talked in depth about. Everyone handles trauma differently. I'm not saying my way was the best or safest or healthiest way, but it's what I did. And I've learned, as I've gotten older, that it's okay and it should be spoken about, and that we need to discuss, how these diagnoses, how these treatments, how everything that we go through as patients has such a great effect on us. And the trauma, also greatly affects us. And I, think I've made it easier, and I know you're included, for a lot of people in our community to talk about how the trauma affects us.
I can't remember the name of the actor, but the documentary Cracked about the SNL actor. What was his name? We'll come back to it, but the documentary is his journey, through the trauma that he experienced. And I remember in part of that documentary, they said anything that can't be spoken about becomes a new trauma. And that's the only way to get rid of the shame, is just to stop holding it in like that. And yeah, we've done those things, in whatever way we do to get through trauma, but holding it in and holding all that shame doesn't help us heal.
And I've also become a really big advocate that disabled people can have sex. Like, I don't
Mhm.
know where there's this huge stigma, um, that, disabled people can't or shouldn't have sex, but we're human. And that's something I also talk about pretty candidly in my advocacy work.
Yeah. Um, what needs to be better, MJ, in the healthcare system? I mean, I feel like in my journey,
Everything.
yeah, true. Okay, fair. How do how do people listen more to patients, or how do patients speak more confidently? What is it that can help us move more quickly and less painfully towards things that we know are happening to our bodies?
First and foremost, I think not we as patients, I think the healthcare system as a whole, pharma, you know, hospitals, physicians, anywhere in healthcare just needs to do a much better job actually communicating with their patients. And, you get, if you're lucky, 15 minutes to speak with your doctor and have them do their assessment. And, if you're lucky, 17 minutes. And, you know, you're on such a time crunch. And I am going to go for lupus brain and say that I totally lost track of what I was saying. It does exist, people. It is a thing. Um, what
Public
can we do
service
as a
announcement.
person?
How can the healthcare system be better to actually listen to these things that we know are happening to us?
I wish I could say take more time with your patients. It's just not feasible. Um, for a multitude of reasons. Um, but I think there are ways that healthcare can bring more patients to the table. We have to get pharma more invested. And it has come a really long way since I started my advocacy journey in 2014. I mean, I remember being at conferences that were called like, you know, the patient experience or, patients as partners. And I'm not saying those trials or those conferences specifically. I'm just, pulling names out of thin air, but like literally being next to someone from pharma going like, oh my gosh, why are patients even here? Why are they sitting at our tables? And although we've come a long way, we have a lot of work to do in clinical trials, building them from the ground up, getting patients involved. It really starts with the sponsors. These treatments that we're receiving start somewhere. Where do they start? They start with R&D and development and research with the sponsors. So bring in patients, bring in all the patients, because we have stories, we have experiences, and we want to talk and we want to be a part of this.
So we've had this conversation. I can feel you connecting to the different emotions along that journey. Um, if I can ask just a really personal question, what for you has been one of the hardest days in that journey for you?
You know, Pre-diagnosis, I'd have to say that morning of defeat when I woke up barely able to walk, looking like Shrek, or if you've ever seen the movie Hitch, when Will Smith eats the shellfish, that's what I looked like. It wasn't cute, guys. Um, and just feeling so defeated, like, how can they look me in the face and tell me nothing's wrong with me and send me on my way? And I think, you know, when my husband dropped me off at that ER, and I just said, oh, I'll see you hopefully sometime when I get an answer, and knowing, full well that I wouldn't get an answer, but just knowing that I had to march through those doors again, to tell them like, you're wrong. There's something seriously not right with me. What do I have to do to get someone to listen?
So then, what is one of the best days or experiences for you?
you know, just my advocacy work in general, getting to speak and connect with not just lupus patients, but the entire, patient community and what we do. But when I get those emails from newly diagnosed lupus patients who say, I don't blog anymore. I haven't blogged since 2020, but I had a blog called Luck Lupus, and it's still live. You can read some really old, outdated posts. But the messages on Instagram or emails, that say, your words have helped me in my own journey. Um, that's why I do what I do. It's part of why I'm a nurse, and it's, you know, although it wasn't the turn I expected my life to take, I never planned on going down this patient advocacy journey, but here I am. Um, Gosh, 10 years later, just knowing that I made it a little bit easier for one person, makes me feel like I'm doing something and making my little mark on the world.
we've said several times during this conversation, the things we've talked about, or I think it's only fair, since this is unfiltered, to acknowledge that we started out as advocates and then became friends who supported each other and now get to be in a relationship. So we need to be unfiltered about that.
Okay.
Well, as someone who
He's
has
my
grown
boyfriend, guys.
and as someone who has benefited and grown because of your words and your authenticity, I want to say thank you for all of that. And thank you for sharing your story on Grit Unfiltered.
Of course, of course. And if anyone ever has any questions about lupus, you're newly diagnosed, you think, maybe you're showing signs, you can reach out to me. My Instagram handle, where I am most, oh my God, what's the word, Dave?
Active?
Active. Woo! I swear, kids, it's the thing. My Instagram handle where I'm most active is at MarlaJan. Luckfupus.com is my blog. And my email is marlajan at luckfupus. And yeah, thank you for having me speak some of my truth today.
UMJ. Take care.